Tonight is Thursday, January 25th, 2024. This is the North Andover Board of Health, and I officially call the meeting to order. We will begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item on our agenda this evening is the approval of meeting minutes from November 16th, 2023.
I reviewed the minutes and any changes were made, so I make a motion to approve the November 2023 meeting minutes.
I'll second that. All those in favor?
Aye.
Okay, meeting minutes approved. We are moving on to the next agenda item, which is the public hearing. Can I have a motion to officially open the public hearing for Laura Mesa Garcia for body art regulations variance request?
I move that we open the meeting as instructed.
Great.
I'll second.
Thank you. All those in favor?
Aye.
Okay. Brian?
All right, I'm gonna call Laura up. She's here with us. You can go there or at the table, your choice, and just give us a rundown of what you're looking for and what the board's gonna debate on the variance for.
Okay, my name is Laura Mesa Garcia, and I'm here to request a variance on the body art regulation for, it's required to have 2 years of experience. I have 3 years, but I've only been licensed for 1, so I'm requesting that second year to be waived. I got trained back in 2020 with Sokova in Lexington. I did my training with her, and for 2 years, I was her apprentice for 2 years, and then opened my own studio in Stoneham back in May of 2022. They were not, sorry, I'm a little nervous. There was some hiccups with the Board of Health over there. They didn't have a director, or they were in the transition of hiring someone. So I submitted my paperwork. It kind of got lost, and then finally heard back after reaching out multiple times, finally was able to get a hold of someone. I just so happened to get the opportunity to move to Lexington instead, so I chose to move to Lexington, and I submitted my paperwork, application, and they were able to take in my apprenticeship letter form from Sokova, and were able to grant me my permit for the establishment and practitioner permit. I was there for about a year, and now I'm in North Andover and hoping to continue my services there. But yeah.
So in our regulations, section 10, I sent you guys the regulations, does require 2 years of licensed work. I did reach out, I did speak to my counterpart in Lexington. She was licensed there. I don't know the director in Stoneham, but I know they did go through a transition. Everything else is in order. She has all of her experience, all of her trainings, all of her coursework, and all of her other certifications. Anatomy, physiology, bloodborne pathogens, things like that are in order and are up to date. So the only thing that she's missing is the documented of 1 year experience to make the 2.
How does it work normally when, if she finished the apprenticeship in North Andover, she can automatically...
If she was here in Northern Andover under an apprentice license, we would have that obviously documented. And she would have for her supervised clients, and then her documented clients under supervision of the body art practitioner.
How does it work if, she finished her apprenticeship in Stoneham and then wanted to come to North Andover right away and start a business?
If she had the documented experience,
Okay.
then we would take that. If she apprenticed under somebody and did 2 years, we would take that as an apprenticeship.
So I guess I'm confused that all of a sudden now you just have to establish, just because she wants to come in and open a business in North Andover, that it's that weird, you have to have
Yes.
Okay.
So the way that it works is typically these are written for body art, meaning tattoos. Tattoo artists typically don't go to aesthetic school. They come up through the ranks of a tattoo studio and get a couple years experience before they can even touch somebody. If you're working in a studio under a licensed practitioner, you're starting with, you're sweeping the floors, you're working your way up before you actually touch a needle and go to anywhere near a client. And over the course of the couple years, you learn the procedures, sterilization procedures, septic procedures, things like that to get your knowledge. Body arts now is a little bit different because we have estheticians doing microblading. It's semi-permanent. It's not quite as involved as a tattoo with all the different colors, and the depth is different, so it's a completely different process. But we want our practitioners to know what they're doing if they're coming in, so that's why we require 2 years experience. We want somebody to come in who knows how to do the procedures properly and safely. So there's no real school for that. You do your anatomy physiology, you do your skin, you do your aesthetics courses, your color theory, everything like that, and then you go work in a salon which doesn't have a tattoo artist teaching you all of the ins and outs of the business. So it's two industries that have kind of merged into one permit, and then they're both completely different. So this is our guarantee that the person knows what they're doing and can function safely and properly.
And these variance requests just allow us to do, or
Yes.
you to do the homework?
To do the
on make
vetting,
sure-
to talk to the person, see how knowledgeable they are, how long they've been in the business, where they've been working, to get a feel for somebody not just coming off the street saying, I'm gonna start cutting people's faces open,
Yeah.
essentially,
Yeah.
to put it bluntly.
Yes. I guess my question would be, essentially then the logic is we're saying that we believe that she has 2 years of experience in essence. It's just not well documented enough to be
Correct.
able to come up with it. I guess my concern is precedent-wise, what's to stop the next person from saying, well, I've got like 8 months of experience that's documented, but I've
Yep.
got,
Exactly.
another
That's-
14 months that's good.
Yep, that's the
Take that
caveat.
away. Yeah.
Are they knowledgeable? Can they prove to the board they know what they're doing? If you wanna ask her questions about,
Well, I'm not the person to tell you.
Neither
we've
am
got a
I.
few medical professionals here, that if they have some questions and want to test your knowledge, by all means. But just knowing skincare and knowing aesthetics and going through the esthetician courses, you do learn all of that. So I think substituting a year experience for a 600-hour aesthetics license is an
Another
option.
way to get there. Yeah.
Right.
Okay.
Yeah, it might just be worthwhile for the future, maybe to look at the policy
Yep.
and see other
And
things,
that's
like maybe like
Yeah.
a couple of letters of recommendation or a letter, like.
I
just
did
to-
speak to the director in Lexington, and she did say that she had a good reputation.
Okay.
Yeah.
I mean, I'm not, trust me, I'm not downning any of this.
No one's imputing
I-
your
We're
reputation.
just trying to help our, just
Yeah.
better, what we can do better for the future.
We're sure you're great.
Yeah, yeah.
Yeah, but it's one of those things where
Yeah.
there's not a lot of documentation town to town because every town has their own body art regulations. So it can get confusing for us talking back and forth to each other about practitioners moving back and forth, and also for the practitioners themselves. But she does have the experience that she does have documented. She does have the trainings, and I did speak to the director, and she did take her 600-hour aesthetics training at Catherine Hines.
Yes.
Yeah.
I make a motion to close the
Does it say
meeting.
Any other questions? No? Okay.
I'll second that.
Okay, all those in favor?
Aye.
Aye.
Okay, the public hearing is officially closed. And now I'd be happy to take a motion if we have a decision.
I'll make a motion since I asked the questions. I'll make a motion to approve the variance request.
Yeah, I'll second.
Can I friendly add?
Absolutely.
With some language of recommendation for thinking through better ways to modify how this regulation can be further improved going forward,
Yep.
so that it can account for these
Yeah,
kind of
it
situations.
was written, I wrote it in 2018. We amended it in 2019. It was adopted in 2020. So it is 4 years old at this point.
Okay.
Okay, all those in favor?
Aye.
Okay, You successfully have a variance for the body art regulation, and we will also look at modifying the regulations moving forward.
Thank you so much.
Congratulations.
Next, we are moving on to old business, to the Community Health Improvement Plan.
All right, so I did send it to you guys. This, obviously, as you know, has been being worked on for a long time. And I don't know if you guys have a printed copy, or if you guys remember what
I read
I
it.
said. Okay, you guys read it? Okay,
Word for word.
good. Word for word.
All those
All right.
You gave us a lot.
It might
This
be
is-
great
yeah,
if we all
sorry.
open our phones.
I'll just go through it briefly, just kind of run down what I'm thinking. Obviously, this is the first time I'm presenting the actual report to you guys. I think it's pretty much finished at this point. We're on schedule with starting. I wanted to do it last month, but I didn't quite get to it before the holidays. But it's written, it's done. It's been a year and a half in the making, so it's a long time coming. So basically what it is, it's our community health improvement plan. It started back in the fall of 2022, and we got the ball rolling. And then it went all the way through up to the spring of 2023. Spring, summer, and fall is when we actually started writing the plan and getting everything taken care of. So the purpose of it is to identify priority issues for action to improve community health. Outline an implementation and improvement plan, and guide future community decision-making related to community health improvement. It started way back in, like I said, the fall of 2022 with community engagement. We formed an advisory committee and then formed CHIP work groups and did a community survey. We got almost 500 responses for the survey that we designed through those two groups, and kind of got the ball rolling there and came up with our three main priorities. Number one was mental health across the lifespan, and I'll get a little bit more into that. Affordable housing was number two, and diversity, equity, and sense of community was number three. Those were the top three topics that were identified in the focus groups, the advisory committee, the survey, all the stakeholders we talked to and met with. Those were the three top priorities. And then development of the CHIP strategy for the next few pages in the report. It goes over the steps that we took to get to those. So the planning model, joint capacity building sessions, pre-planning sessions, several virtual planning sessions to develop plan components, goals, objectives, potential outcome indicators, strategies, and potential partners. So there's a whole long list of people that were involved in that entire process here. The advisory committee was made up of subject matter experts, external partners, and other key stakeholders for input and feedback. And that advisory committee did the entire thing all the way through from start to finish. The focus groups broke off and did focus pieces to add into the report. And then we came up with the goals and objectives. Like I said, mental health across the lifespan was a broad topic because, as our presenters will get to talk to in a little bit, it started with focus groups at the youth center and focus groups at the senior center all had the same issues. Granted, they're a little bit different, but anxiety, depression, isolation, substance abuse, like all the way through the gamut. So we couldn't narrow it down to be like elder health or elder mental services or just teen anxiety and depression, teen suicide. We had to lump it all into one, come up with one big category. So what we did is we got the three goals and then broke them down into objectives. In objective one, mental health across the lifespan has 4 objectives. Affordable housing has 3. Diversity, equity, and sense of community has 4. And each one of these objectives then goes into more detail as to how to accomplish each one of those objectives. So pages 10 through 20 in the report is goals, objectives, and strategies and partners. So who is going to help you tackle that objective and that goal? They're listed out, and then all the different strategies and the objectives for each one of those. So that's a good little chunk of the report right there. And then it goes into the implementation phase. That brings us to the appendices, and obviously in here is the CHIP planning participants, the advisory committee members, definitions, acronyms, because everybody loves acronyms. And then Appendix E is an entire chart of all of the implementations and actions. So step by step, who we're bringing in, who's gonna be in charge of it, and who's gonna start to work on it. So this is gonna be a big, heavy lift, but it's a broad timeline. I have it marked off in quarters, so like quarter 3 right now, and quarter 4 is January to March, and then April through June. And then the next tasks go to July to September, and October to December. So it's a whole year-long process for some of these objectives. If one is dependent upon the other, it gets pushed back a little bit. This isn't a set-in-stone timeline. It's a gauge and a guideline for us. So we're going to start working on some of the beginning objectives now in the first quarter and roll into the second quarter. So yeah, so each priority has their goals and objectives listed out, who the partners are going to be, and this goes on for several pages because there's a lot of goals and objectives here. And hopefully this is completed, and I don't know if it's ever going to be completed, but we're going to start to chip away at it now, and it's designed for a 3-year process. If it's 3 or if it's 4, so be it, but we finally have the final plan. I wanted to present it to you guys, have you guys look at it. Any changes, any recommendations, any questions, let me know. I would like to get it posted on the website and then sent around probably sometime next week. But I wanted you guys to look at it first and give any feedback. You good?
Perfect.
Yeah.
All right. And I did add in a logo here and the health department logo here. So we put our name on the front and center.
And then do we want to make a standing agenda item every quarter for an update?
I can do that?
Thank you. That was gonna be my question.
Okay, great.
How do you know we've have or attained success, or what the current roadmap is? So.
And that will tell you. No.
Surprise.
I'm kidding. So, okay, that's it. That's the Community Health Improvement Plan. I will send this off to everybody once I get feedback from you guys, and we can see where it goes.
Great. Okay. Moving on to communications, announcements, and discussions.
Okay?
Hand it over to you to announce our guests.
I'm getting it up onto the screen now. We have a PowerPoint presentation from JECC Behavioral Center, LLC. Virginie is going to probably start off, I would assume.
They're doing it.
You're going to do it together? Okay, great. You can sit at the chair, or you can sit at the podium. Does both work? I've got your PowerPoint. Just tell me when to move the slides forward, and I will. So we've got it in front of you guys, and they have it up there on the big screen.
Thank you, Brian.
Good to see you again.
Yes,
Welcome.
thank
Thanks
you.
for coming.
Good evening, everybody. Thank you for the wonderful opportunity given to us today to be in front of you, to tell you who we are and what we do, where we're located. We are JECC Behavioral Center. We are a mental health and ABA services. We're located down the street, 10 Main Street in North Andover, floor 2 and 3. So that's where we are.
Yep. Hi, everyone. So we can advance to the next slide. So on the next slide is our agenda for today and just the different areas that we will be walking the whole board through. Next slide, please. So before we dive into our objectives, we would like to begin with one of our favorite quotes, which is, "Trauma cannot always be conquered, fixed, or resolved, but it can be heard, held, and loved." And today we will be giving you an introduction into who we are, while also illustrating how we actively contribute to the community that we cherish, which is NA, of course, and then.
And we'll walk you through with how we provide and promote awareness in this community we serve and beyond. We also will walk you through how we engage our client and family to foster an environment where we live and deeper awareness of ongoing and commitment to making impact and differences in everyone's life. Next slide, please. So I am Virginie Kasiama Kamwene. I am the founder and CEO at JCC Behavioral Center. And we have Chelsea.
So hi everyone, I'm Chelsea Kamwene. I am the Vice President at JCC. I would also like to say that I'm a proud NAMS and NHS graduate.
Awesome.
And so a little bit about myself is I received my master's in social work from Boston College. And I am a social worker who is committed to implementing systems within the community level to better, to provide positive outcomes for all.
I just want to add who I am. I've been a clinician for going 11 years in this community and across the Merrimack Valley. I got my 2 master's degrees, both Massachusetts State license eligible. I've been providing in-home therapy, traditional therapy, school-based. I've been across the schools, work with the school system, and also work with DCF, reunifying and uniting families.
So now my colleague here, who's also my mom, will be moving us into talking about the motivation behind how JCC was created. Next slide, please.
Just to tell you a little bit about the story of JCC and the existence, our organization emerged from my personal experience. I am a mother of 4, 2 boys, 2 girls, and my last one is an autistic in a higher level, is nonverbal. From my own experience, I faced a lot of health disparity and difficulty accessing to resources. And being a parent, that gave me the courage. I went back to school to learn more than relying on a provider, which we think when we have a provider come for a few hours and what will be next on the well-being of your child. Also, the pandemic has inspired me that I saw my own struggle, and a lot of families, I work back-to-back 24 hours every day during the COVID pandemic over the phone, and it was a struggle. We see a lot of anxiety, depression. That was one of the inspirations to see the struggle that we can create. There were long wait lists, there were lack of provider, there were short of provider, and that brought us to a point that why don't we create something where somebody can walk in, somebody can call us. I go beyond that. I can be in my house at 8 o'clock, somebody call me, I will answer my phone, and to reduce that wait list and provide the services to make differences. While I am a resident in North Andover, it came to me, let's start in North Andover and beyond other cities. Next slide, please.
So today, we would like to discuss social determinants of health. So social determinants of health is at the core of our practice. And reading the community assessment, we were really excited that it was also a major focus for our community. So as you all know, social determinants of health are social barriers within either the individual, community, or systems level that tend to hinder positive outcomes for many of the individuals. So today we will be looking at JCC's efforts within the 3 levels that help contribute to positive outcomes within children and adult lifespan. So next slide, please. So we will begin on the individual level. Sorry, next slide. So on the individual level at JCC, we focus on destigmatizing mental health to foster inner healing and bring individuals back to baseline. So that begins with our mental health practice being across the lifespan. We service more than 500 clients, and as you can see, the first graph just illustrates a diverse range of the different ages that we offer services to. And as you all know, within social determinants of health, there is an inaccessibility to affordable health care. And within that, at JCC, there are no preferences within an individual's insurances. We accept a sliding scale payment.
I just want to add what Chelsea said on our mental health practices across the lifespan. At JCC, we take clients from 3 to 80 years old. And then we are a diverse population, as our mission and vision is to provide services to anyone that has been struggling without looking who they are, where they come from. We embrace the concept of DEI, equity, diversity, and inclusion of everyone across the lifespan.
Next slide. So on the individual level, our clients at JCC have a choice and access to various different types of therapeutic services. So we have outpatient therapy, our children's social skills group, while also along with caregiver skills training. So this one helps with any caregiver or parent that would like to learn more about just caring for someone on the spectrum, or if the child has any mental health disruptions occurring. And then finally, we also have children and adult mindfulness group.
We also call JCC a sanctuary of children, adult, those are struggling with ongoing life stress. We provide in-home traditional services, which is in-home therapy. We provide ABA therapy. We provide anger management and court mandate services. We partner with a lot of organizations that refer the client to us. So we have an array of services at JCC Behavioral Center.
Next slide.
So the next slide, we're going to dive the community level. Next slide, Ryan, please. As you can see the map, on a space of 3 years going since this business exists, we provide services from various towns and cities within the Essex County and beyond. Our client comes from North Andover, Haverhill, Methuen, and other city out of Essex County, which is Medford. We get clients from Malden. We get clients from Lower Chelmsford, Tingsboro, so we cover the area in the Middlesex County and beyond the Middlesex County. Next slide, please.
So on the community level, JCC collaborates and coordinates to provide wraparound services for our clients. So we will be walking you through different areas where JCC focuses on the community level. So we have school-based mental health support systems, ongoing support after hospital discharge, and also we have a multifaceted support system on a needs basis. Next slide, please. So on the community level, focusing on school-based mental health support, we serve the community by contributing to efforts to the various efforts listed onto the screen.
We really focus on, we have a system that is established in the community, which is one of those are familiar with schools and knows that there's an institution which named Care Solace that work with the school district by connecting a school, parent, and other clients in the community struggling with mental health. We really connect with this institution on when they're having a crisis or an emergency, a walk-in for a child and family. We are working with the school, partnering, especially me, myself, in North Andover here, a little bit known with the school by decreasing suspension rate, also decreasing expulsion, decreasing school behavior, and work with the school to maintain children to be in school the whole day, decreasing school avoidance, providing support and guidance on individual education plan IEP. I support parent and our client because I live the IEP through my own personal experience day by day. Some parents feel they don't know what the IEP is about, and you need to educate them, support them, be there, work with the team that's working with the individual education plan. We also support our clinician. We can see we have supervisor here that's supporting tonight. And we provide support on a 504 plan, on a general education and accommodation by giving recommendation that meet the need of our client. We assist the school counselor. I have one of my clinicians here always on the phone doing the escalation when a child struggling in school, providing support on children academic by checking week by week on the progress of our client in the school. Our main collaboration here being in this town is the North Andover Middle School, North Andover High School, North Andover Andover Middle, Andover High School, West Andover West, and the Lawrence, various schools in the Lawrence and Methuen areas. Next slide, please.
So for ongoing support after hospital discharge, JCC collaborates with clients and hospitals post-discharge to provide ongoing outpatient support. So a few of our collaborators include Zion Medical, North Medical, Pentucket Pediatric.
We collaborate. Our main collaboration started and continue with the Greater Lawrence Family Health Center. They are the main resources, the main referral, because their mission, our mission, we all work on a DIE missions. So Greater Lawrence received a variety of clients for around the world, which have difficulties with languages. And JCC's multilingual center, I personally speak 7 languages fluently. So we assist with clients to reduce frustration, to help them adjusting on a transition, being new in the country, and guiding them with difficulties with reducing translation. And as we have bilingual clinician in place, and also we admire our collaboration and partnership with Greater Lawrence, that day by day, doctors, referral center, we work with them in order, if there's an emergency, a client who's struggling, have to walk in, we don't have a wait list for them. So that's why we receive a lot of clients day by day. And also Holy Family, before they discharge a client or other psychiatric hospital, they need to call us to make sure before we let somebody struggling with difficulties that we can be able to stabilize and provide ongoing support after the discharge. And the client know exactly after they've been discharged, the appointment have been set and where to go. We have elderly clients sometimes walked in with language difficulty, and we have clinicians can assist them without paying for a translator right on the spot. We attend them. Really, we don't have a wait list. We're also reducing the long time waiting in the emergency room. Sometimes we wait for 5 hours. I myself go with the child who's after 6 hours, my child become normal because we're not being attended. At that time, that frustration we're reducing, that we have phone call after hours, we follow up with our clinician, client. Next slide, please.
So for our multifaceted support, JCC focuses on the whole person, because we believe that slowly focusing on either the behavior or the diagnosis does not help to improve the mental health for the individual. And some of the services that we provide are therapeutic mentor services. We also provide need-based food and clothing support for any of our clients that are in need, along with our clinicians also provide letters and referrals to shelter placement, in-home therapy. Our parent support group is for children with autism and also not on the spectrum as well, along with assisting clients in understanding they diagnosis or they children's diagnosis as well. And we also host many community events, including social skills group, holiday events, and yeah, next slide.
We also adding what Chelsea said in JCC, we always say that before we treat the client, we don't treat what is in the box, we look behind the box. Having different lens that looking what creating symptoms, how we treat the symptom without meeting the hierarchy of need, which is my favorite quote that I always use, that we have to treat and also follow up, look out of the lens on what they came in with and what creating the stressor. That's why we work in collaboration with the resources in the community, as she mentioned, housing, which is the main stressor for our client. I'm homeless, I'm gonna be evicted, I didn't pay rent for 6 months, what can I do? I'm depressed and having those symptoms. So we really connect and work in a synergic way that after us we treat and we refer out after where the need also can be met.
So now we will finally bring it to the systems level work, and within the system levels work, JCC also participates within the juvenile diversion program, and like I mentioned earlier, our clinicians provide letters of recommendations to the residential assistance for families in transition, which is known as the RAFT program. And also we are collaborating with the Department of Transitional Assistance for things like food stamps and anyone facing a food insecurity. And our overall main collaborator is the Department of Children and Family. And we also, and my mom will dive more into the work that she does with the court system.
Yes, through my own personal experience and others, I've been working with the diversion program since I graduated. We receive clients, mostly children from 12 to 18, that are facing difficulties, that are in the risk in the community by providing counseling education, to reduce the high risk with substance use, educating them on marijuana use and vaping, other issues, because we're receiving a lot of number of clients facing in the young age these issues. We work with the court one-on-one by providing the summary of the recommendation that the court sent to us and ending the probation. We also provide, we work with DCF by assisting custody battle cases and also stabilizing and reunifying families and children in foster care. We're providing ongoing support and services to foster care children, and the Department of Developmental Services, which we are in partnership right now by providing ABA for children with autism and other disability related. That's why we provide. I run a parent support group for the Merrimack Valley monthly by providing resources, sharing resources, educating and empowering parents by understanding the diagnosis and reducing family stress by providing self-care resources. So that's what we do at JCC. Next slide, please.
Being stubborn.
Yep.
So to conclude, we hope that this presentation illustrates how committed JCC is to offering services to the diverse population within our town and also across the Merrimack Valley. So just to leave you off with, for the year of 2024, JCC will continue to help clients identify and address personal challenges. We will also strive to create opportunities and expand access to mental health services. And finally, we will continue to support our clients through every single step of the journey. Next slide, please.
Again, thank you for your attention and thank you for the opportunity given. I cannot thank you enough how I met with Brian, I met with Tony, and how we came across this assessment. I think this assessment is really meaningful to us since we are located in town and providing these services. Our hope is to work together and to continue to make impact within our community and the family that we serve. And we leave you with one of our quote is, let's work together to be proactive and not reactive to our community need. And we have information down there. Our building is right down there where you can find us. And we're really hoping to partner and work together to meet the need in this community and have the client achieve the daily goal by relying on us as a provider to meet them where they are and help them to be back on the baseline on a daily basis. And thank you very much for this wonderful opportunity.
Thank you. Thank you for the wonderful work you do. Does anybody have any questions for them?
No, I mean, you guys are amazing.
Yeah.
Thank you.
So I am the chair of medicine at Lawrence General Hospital, and so I was actually just at a meeting with all the administration and the new CEO, and the one thing that they were talking about was just and this is not just exclusive to Lawrence General, just the profound mental health burden on hospitals and ERs. And they were quoting that the average ER stay for a child waiting for a psychiatry bed is 45 days, and the average wait for an adult psychiatry bed is 18 days. So that is profound in the emergency room. And then you can imagine these people sitting in an emergency room with how those emergency rooms operate. So, I'm not sure. I think it would be worthwhile to certainly reach out to the higher ups at Lawrence General, potentially even through Greater Lawrence, to try to collaborate with them. I see you already collaborate with Holy Family, but they are putting mental health as a top priority for them. So I would definitely strongly recommend you to reach out. I mean, for whatever 10 employees you have, you probably need about 4,000 more just to handle the Merrimack Valley. So, I mean, there's clearly the need is just you can't even describe it. So, thank you.
Thank you so much for that input, and that's why we're here. We want to enhance services. We want to reach those areas like people call it Newburyport. I myself am multitask, and I do ABA. I do administration. I'm a mental health clinician. When there's family that in need, we cannot contain children in a traditional setting because my child ran across the chairs. My child jumped, and that stigma, we're breaking that, we're meeting them where they are. So I'll leave my office to go to Andover to do an assessment when they're looking for in-home therapy. We need to hire. Our struggle is that the insurance payer. Sometimes we expect they give you a deadline, you provide services, it's 45 days, they're paying money. But when there's a lot of client, and we cannot drive them because, for example, so-and-so didn't pay me, you not receive help here. We have to continue to provide help, and we're really looking, enhancing, we're becoming bigger to a capacity of a clinic to hire more staff that can go in the community school and meet those client needs and make an impact. It's a legacy that we don't do it for us. It's passion that we have to give back to the people that we serve, and they can feel comfortable to call and seek services. We're also looking with the help of supporting us that at Andover, through my history of working as a clinician, Andover, North Andover relay on a crisis in Lawrence. And it's not fair that we have a lot of school. We are working to enhance our services, creating a pediatric behavioral emergency crisis line that we can collaborate with the school. Parents can call over the weekend, they can call. Sometimes also Leahy in Lawrence, we work in collaboration. They're very overwhelmed because there's few crises, mobile crisis in place. So that's one of our goals, to create that in this town so we can accommodate to the school and the community.
I'm sure there's some grants that you can tap into, state and federal level, that would support those needs, because mental health is so it's huge that I bet you'll be able to find a grant to support that very easily.
Yeah, I'm the mom of a son with behavioral ADHD, and man, do I wish I heard this talk from you guys 5 years ago when I was starting the process, but thank you.
Thank you very much. Thank you.
Is there anything we can do for you? Is there anything the board can do to assist you?
Yes, when I spoke with Brian, we're looking for grant for support. Really, the capacity of the space that we have, it's really getting small. That's one of an issue. Like during the week of coming for vacation, we host a boot camp. We don't have a space. Children with autism doesn't have social skills, which is the main demand. With the we start doing it when we went Southern Street. The space got, and again the landlord, sometimes they say you're making noise and kids running away. They don't understand what we do. And then we move to Main Street, but the space is really, we're looking for support, we're looking for grant that can help us to really enhance and use it by providing the services. Our community is in crisis, our community is in a higher need of seeking for help, but we're limited. That's why we are here. If the board can help us, what I'm saying, our hope is to work together and support us, and we can give you the result, the outcome that you're expecting through your assessment that you conduct. We are the candidate. I think we qualify for this.
That's one of the reasons we did the CHIP, right? Because it provides, when you are going out for grants, it provides that connectivity,
Exactly.
all the background, the community need, yeah. So hopefully the work we've done will also help you in that effort, yeah.
That sounds great. Yeah, I'm more than willing to sit down again and come up with some action plans.
Well,
Thank you so much.
Thank you again.
Thank you.
Thank you. And thank you to everyone else who's
Yeah.
here
Yeah.
too.
Thank you.
Thank you.
Your
Thank
support
you so
team.
much. Thank you.
Thank you.
Awesome.
Okay.
Before we do the next one,
Okay.
under communications,
Yep.
I was going to do
Sure,
Annette
go for it.
first. I want to do Annette. Introduce Annette. She is our new shared services coordinator. She's been with us for a while now, actually. But 6 months?
Yeah, 6 months in
Yep.
December.
Well,
Yeah. So the grant's been up and running. We are trying to get stuff done. Let her give a more detailed rundown to everything going on.
Yeah, certainly. So we're about halfway through the fiscal year 24 and making some really significant progress on our work plan. To date, some of our big accomplishments, we hired a part-time public health nurse who started at the beginning of the year, and she's done a really great job of going out and meeting the communities, meeting with the local health nurses, and coming up with some really great education plans for the future. So we're currently partnering with the senior center here to develop a diabetes education pilot. She is working on we plan to meet with them to develop about an hour-long just presentation, general information on diabetes education targeted towards seniors, and then having an opportunity where she can actually perform blood sugar tests for those seniors. And then once we pilot it here, we plan to then expand it to our other 6 communities. She's also working to do a pilot friends and family CPR in Haverhill, and same concept, pilot it there and then make it available to all 6 communities. We also have been working to come up with a regionalized plan for permitting food trucks so that all 6 communities are not doing plan reviews for the same food trucks, inspections for the same food trucks. So we've been making really good progress with our inspectional subcommittee to develop policies and procedures where the regional inspector would be the one to do the plan review, the initial inspection, and then they would be cleared and ready to go get their permit from any of the 6 communities in our collaborative. The other thing that we're currently working on is developing a model body art regulation that can then be adapted. So I know that's going through perfect timing. But essentially we're developing a model regulation that then each health department can bring to their board for review and integrate any of those changes into their existing regulations. And we've done a lot of research on other more updated regulations throughout the Commonwealth, as well as looking at the National Environmental Health Association model reg. Just to bring them up, most of our communities haven't even updated the regulations since they were first enacted in 2001. So really just bringing it up to the standards today. There's been a lot of progress.
Gold standards.
There's been a lot of progress in the field. So those are some of the major things that we've accomplished thus far, and definitely have plans to move some of these items forward over the next 6 months. And I think we're on track to achieve all of the goals we've set forth for this fiscal year. So it's been exciting to get it up and running, challenging but definitely rewarding, and really seeing how all of these communities are coming together, having these conversations, and thinking about how can we work across the region to standardize health services, and really lift each other up to make sure that all residents in the communities are receiving the same level of public health services and filling any of those gaps that we've identified.
Wow, great.
So yeah.
Any questions about the grant, or I'm happy to answer.
Welcome belatedly aboard.
Thank you. Thanks. Sorry it took so long to get here.
And we just got our new contract amendment, so it's been raised up to $532,000 a year.
Awesome.
So it's substantial, which gives us some room and some resources to work with, which is fantastic. One of the things we have done with this is the next item on the agenda, which, if you guys saw in your packets, there's a little letter that we're going to be asking for the selectmen to, select board to approve our grant funds. And I'll let Annette discuss this next as well.
Yeah, certainly. So one of our objectives for the Public Health Excellence Grant was to work towards the FDA retail food standards. So this is a set of 9 standards that the FDA has developed to help local authorities create, I'm trying to think of the right word, but stringent and effective food safety programs. So one of our goals as a region is to start meeting those standards. So in advancement of that, we applied for the NEHA FDA Retail Flexible Funding Model Grant, and were awarded it for the 2024 calendar year. So this is an award of $26,500 that can help us work towards meeting those retail standards. So with those funds, if accepted by the select board, we have 3 main goals that we're hoping to accomplish. The first is to complete a self-assessment and comprehensive strategic improvement plan. So these are documents that will first look at how well is North Andover currently meeting the standards. Most applicants to this grant meet very few, if any, of the standards when they first start, but it really helps us establish that baseline of where is North Andover currently meeting the standards, and then creating a comprehensive plan for how we can improve and meet those standards in the future. This program is aimed to be in a 5-year cycle, so that comprehensive strategic improvement plan will create a pathway forward over the next 5 years to implement new policies, new programs, and procedures to meet those standards. the second part is that we opted into the mentorship program. So we've been matched with a health department in North Carolina who has already actually completed and met all 9 of the standards. And this grant will offer us the opportunity to do a site visit in North Carolina. They can come and do a site visit here to see what our current food safety programs are like, and they'll help just provide that subject matter expertise as we start to develop some different policies and procedures within the North Andover Health Department. And our goal this year is to fully meet Program Standard 2, which relates around trained regulatory staff. So we just have to come up with a standard training plan and verification plan for how we're training our food safety staff. And so that mentorship program will help us establish those guidelines. We can use what they've already done to ensure that we kind of have that vetted procedure for training staff. And then the third part is to send 2 staff members, Brian and Shanine, to a self-assessment and verification audit workshop hosted by the FDA. So that workshop essentially just teaches you how to be part of this program and continue it on past that mentorship. So it's a great opportunity for them to really learn what are the steps needed to then, after this year, meet each of those 9 standards and follow through with the paperwork. We basically, when we think we've met a standard, we audit ourselves, and then we get a secondary person to audit us. It can be a contractor, another health department that's already completed it, to just say, yep, they meet all the standards, and then we submit it to the FDA. It's completely voluntary, but it just, like I said, helps establish that standardized program to ensure that we're really offering the highest level of food safety protection for the residents of North Andover.
So FDA approved inspections and
Okay,
us as so this is all about food inspections and food safety, training us, and obviously us training the restaurants, and the entire inspection process will just completely bolster our food protection program.
Is it more regulation or more process or both?
Both.
Is there any reason to think the select board will not accept it?
No.
Okay.
No. No, I mean,
No, we don't want money. Push it away.
we don't want money in
Just checking.
so FDA standardized inspections for all of our food establishments, which would just
Great.
be a better food protection
Makes
program.
sense.
Yeah. Thank you.
Awesome.
All right.
Anything else?
Anything else? So, next meeting, I didn't put on for this agenda because it was a long one. Just appointing our annual agents, so agents of the Board of Health, all of us here, and any people we bring in, like Ron Beauregard, our tobacco control agent, does inspections on behalf of the board. So I'll bring the appointments in next time. We do have Leanne Caro is the new regional public health nurse on board as well. We'll do that next time. Meeting schedule. Next February, the February meeting, I believe, is February vacation.
It is.
I think somebody mentioned
Yeah.
I may be here. I'm not sure. I am going away that week. I may be back by Thursday night. But if you guys want to change the meeting date, we can start an email chain going around now. If Tony wants to, see if we can book the room on another night.
I know I can't be, but if everybody else could, you'd still have.
I'm not going anywhere.
I don't believe I'm going anywhere, so
You
my
may.
wife will let me know.
You're a smart man.
All right, so
So it's
the
up
two of
to
us
you.
may not be here, which is fine. You guys can still have a meeting.
We can certainly look to change it, by all means.
Do you want me to try the week before?
Do we want to do this now or not do this now?
What was
I
that?
said, do you want to do this now or not do this now?
No, we don't have to do it now. We
Okay.
can.
We can start an email chain.
Yeah, we can start an email chain.
All right, we'll do
We can all check our schedules and our vacation calendars.
Sounds good.
Aside from that, the only other update that I have is our AED program. We are moving forward, obviously, with getting the AEDs at all the fields and playgrounds. We got the 3 quotes. I've had them for a couple months, but we're not going to install them until April. So I met with Jeff DeShanes this week. We chose the AEDs we're going to go with, which expected. We're going to go with the same ones that they have. So we have buying power with the batteries and the pads every couple of years to redo all of them in town. All the fire departments, all the schools will have the same ones. he's getting an updated quote from that company. We're gonna move forward with them. Probably start the purchasing next week of the AEDs and the outdoor cases. Steve Foster has his guys lined up to build the structures that, you know, we mount them to, and the excavator and the concrete guy to do the pads and everything. So
So they go in all the fields?
all of them,
That's awesome.
every field and every playground.
That's amazing.
Who's
Yeah.
responsible for inspecting them to make sure the batteries are still working, that the pads are okay?
Fire department.
Fire department
Yep.
will? Okay.
Yeah, the pads are good for, I think, 2 years, yeah.
Yes, but you
So-
never know if someone gets into them and,
Oh, they're in lock boxes.
Oh, okay,
So you
okay.
can't open the box until you call 911 and get a code.
oh, okay.
From
That's
dispatch.
smart, very smart.
That's
yeah.
cool.
So once that is used,
Okay.
obviously it's documented, it's dispatched and everything, and then we can
It's
kind of
accounted
redo it.
for.
Yeah,
There'll be training for like coaches and.
I'm gonna have the leagues, we're gonna do a video
Okay.
of how to use them. I mean, they're super easy.
Right.
But we're gonna do a video, and I'm gonna have all the sports leagues have their coaches all watch
That's great.
3-minute
Awesome.
video.
So me.
Yep.
Yes, exactly. I'm gonna ask. I can't make them, but I'm gonna ask them all
Right.
to.
I can
have their
help run
coaches.
it by NASA at least, so.
That'd be great. It'd be fantastic.
But the
Okay.
video is a great idea because then you can also just distribute it
just send
to
the link out
parents,
to all the
everybody,
coaches.
right?
Yeah.
Like, what does
Parents,
it take
coaches,
to-
anybody.
Yeah.
Send the link. These are the AEDs. This is where they are. This is what they look like.
Yeah,
This is the 3 steps.
Right.
Comment in one. Get the code. Punch in the code. Pull out the AED, and then how to use it.
That's great.
Yeah. So, yeah, that's gonna happen.
That's great.
So,
Good thing.
so we got the money, and we chose the AEDs to buy. I'm gonna hopefully buy them this week. They'll be in probably about a month,
That's amazing.
and then we'll get the structures built and the pads dug and concrete installed. And I think the Boy Scouts and Girl Scouts are gonna do something with them as well. I'm thinking like paint them or do some Eagle Scout projects with them. So
Nice.
get them
That's
involved too.
Make them more visible or.
Yeah, yeah.
And then
So-
what do they come down, I'm assuming, in the winter?
Yes, they'll come once the fields
Just like
close.
we're doing it.
After field hockey and lacrosse and in the fall,
Yeah.
or soccer and field hockey, right?
Yeah, soccer goes to like November 4th.
Yeah.
Well, first, second weekend.
Yep. Once those are done, then they'll come down for the winter. We looked at getting the heated boxes and the solar and all that stuff, and they were really expensive.
Yeah.
I can imagine.
So we're like, we'll just take them down every fall.
And are all of our indoor playing surfaces also equipped at this point?
Indoor playing surfaces, like
I'm
what?
assuming every gym and stuff that all the indoor
Every
sports-
school has one. So these are
That's
just
all we have in town, right? It's just
Yes.
school gyms?
Yep.
Yeah.
Yep.
Yeah.
But these are
Youth
so.
center.
Oh, yeah, the youth. center.
Reynolds,
Yeah.
Gallagher, Foster, Grogan's, McAvoy, Carter are all going to have AEDs. Even the high school track is going to have one now. So it's way off the
Fantastic.
track,
Oh,
not
yeah,
way
'cause
at the
there
school.
is that's the field, yeah.
Drummond is going to have one now. So the field and the park and the playground. Yeah, that's it.
Great.
I think that's all that I have for updates. Any updates from our lovely nurse?
I guess in December, our flu and COVID numbers spiked in RSV. Since December, I think we had 186 cases of COVID that were reported. So there's probably a ton more that did home test. But this week, we only had 5, so.
Wow.
But we still have flu shots and pediatric COVIDs and COVID test kits, if anybody's interested.
I've been giving those a lot, actually.
The tests?
Yeah.
Okay.
But we got a whole bunch of the fire department. We did a bulk order with them a while ago. So they've got thousands over there for us. That's it.
Are they available for anyone who just then requests them and how?
You could just walk in
We have a
and
basket
grab
of
one.
them downstairs on the counter.
It's like trick or treating.
Grab and go. Next to the
Go
candy
to a
dish.
wedding and get your COVID test.
Yep.
Rob, how many do you want?
No, what actually spurred the question is, I just by personal recollection, my wife seems to get them through the mail, and I don't know whether she's actually buying them or there's a resource that you contact.
The
and they send them.
USPS is still
Yep.
sending you
Yeah.
COVID test kits. You can get 4 at a time. You just go onto their website, type your address
That's what
in,
it
and
is,
they
okay.
And they're
Ship
free.
I
it
just
to your
know they
house.
show up.
Yeah,
But now I have another resource to tell her that she can avail herself of.
stopping by town hall, we get the 5-packs.
Yeah, yeah. Fingers crossed. I've never shown sign of nor contracted COVID yet, so that means I'm gonna
Okay.
get it next week probably.
You probably had it. No,
Yeah,
Only right now, so.
probably.
that sniffing you had last year.
Yeah. I've been immunized since like the very first.
Yep, same.
Yeah, me too, and I'm full of COVID then.
Yeah, my wife, on the other hand, has got it 3 times. So,
So you've definitely had it. Your wife's had it 3 times.
yeah.
All right.
Anything else from anybody?
Motion to adjourn?
Seconded.
All those in favor?
Aye.
The meeting is officially adjourned.